We still see the data coming out of the CDC or any of the others who report data on COVID reports. Almost 50% of new cases, somewhere between 45 and 50% are from racial and ethnic minority groups, predominantly African American, Latino, and then a significant number of American Indian, Alaska Native, and Pacific Islanders, although they're very small populations. They're overrepresented in cases. Severity, hospitalization, and mortality follows in parallel. And vaccination rates, we're lagging behind, although we have, at least as of September, similar rates across those three main racial ethnic minority groups. Black, white, and Latino Hispanics are the same per the Kaiser Family Foundation survey. So we're pleased about that progress, but we cannot let our guard down. These individuals are more likely to work in public-facing jobs. They don't have the privilege that I do of staying home most of the time and working from and having my home office here. They're also in more crowded parts of living in more crowded urban parts of the city. They're also living sometimes 2 or 3 families in one household. And so the likelihood of being sheltering in place or staying away or not being infected goes down. I think vaccination has got to be the answer. We're getting there. We're made huge progress. And now that the reason I say pivot is because we're going to have oral therapy available pretty soon for early onset of symptoms. And that will make it much easier to treat people early on to prevent further transmission and individuals who have broken through and gotten infected even though they've been fully vaccinated. So we cannot let our guard down on this pandemic. This is not over by any stretch of the imagination.